Hi, this is Dr. Moubayed, and today I'd like to talk to you about ultrasonic rhinoplasty. Traditional rhinoplasty uses metal instruments to sculpt and break the bones, and when you use those instruments, it damages the inside support layer of the bones called the periosteum. And because of that, surgeons cannot separate the skin from the bones to give them extra stability. But with ultrasonic rhinoplasty, we use a special tool called a Piezotome that only selectively cuts the bone and doesn't damage the inside support. So we can free up the whole skin and see the bones perfectly to work on them. And it is the only technological advance in rhinoplasty in the last 100 years. Ever since I started using ultrasonic rhinoplasty in my practice, I've seen better results, less revisions, and less bruising and swelling. Now, who's a good candidate for this? Well, somebody with a wide nose, a deviated nose, a hump on the nose, but most importantly, realistic expectations. One possible risk of any rhinoplasty is to cause breathing problems, which is why it's very important to pick a surgeon that is trained in both the functional and aesthetic aspects of the nose. An alternative to ultrasonic rhinoplasty is injections with hyaluronic acid fillers. We often combine ultrasonic rhinoplasty with other procedures like chin implant, chin liposuction, an upper lip lift, or fat transfer to the face. So how does it happen? Everything starts with a consultation where you come, we meet and discuss your expectations and do some simulations of your potential results. The day of surgery, you come into the surgery center and meet the whole team, including a certified anesthesiologist who places you under general anesthesia, so you're completely asleep and monitored during the time that we work on your nose. We work on the nose using the ultrasonic tool. At the same time, we fix any breathing problems, improve the shape of the tip, or do any other associated procedures. And at the end of surgery, we put tiny little sutures underneath the nose, little splints inside the nose through which you can breathe, but they help everything heal properly, and plastic and tape on the nose. And then you gently awaken and you're able to leave the surgery center, usually an hour and a half later. After recovering for a week at home, you come back to the clinic where we remove everything and reveal your new nose. If there's any swelling and bruising at that time, it's very socially acceptable and you can actually go back to work, you can go back to school, even though it takes a full year for the nose to heal. The best way to get ready for a consultation for ultrasonic rhinoplasty is come in with some pictures of noses you like, pictures of noses you don't like, and come in with an open mind because we're going to have some fun with photo simulations of your face. The fantastic thing about rhinoplasty is that it's one of the only cosmetic procedures that last a lifetime. Most of our patients tell us that they barely need the prescribed painkillers after surgery because the pain level is very tolerable. This was Dr. Moubayed, and thank you for letting me share my favorite procedure with you. And if you want more videos like this, please let us know in the comments section what you'd like us to talk about.